Using gene therapy techniques, a type of disease called severe combined immunodeficiency, or SCID, has a high likelihood of successful treatment. Physicians can target and potentially cure a self-renewing population of bone marrow cells called hematopoietic stem cells, and thereby cure the patient. In a type of SCID called SCID-X1, a gene called gamma C on the X chromosome is defective. When this gene is defective, hematopoietic stem cells do not develop into all of the cell types needed for the immune system to function. Hematopoietic stem cells divide to renew their population. They're essentially immortal cells. Some of these cells differentiate to create two cell lineages. In one lineage, the hematopoietic stem cells develop into myeloid stem cells. The myeloid stem cells further proliferate and differentiate into red blood cells and other cell types, such as macrophages and basophils. A hematopoietic stem cell may also develop into a lymphoid stem cell. Lymphoid stem cells give rise to key cells of the immune system: B cells, T cells, and natural killer cells. In the development of the SCID-X1 immune system, part of the lymphoid lineage fails to develop normally. The gamma C gene encodes a receptor molecule that is required for T cells and natural killer cells to differentiate. T cells play central roles in the immune system. Without them, the immune system cannot function. To cure individuals with this genetic disease, physicians first try to find tissue-matched donors for a bone marrow transplant. In the absence of such a donor, gene therapy is a promising alternative treatment. In this procedure, a sample of bone marrow cells is removed, and hematopoietic stem cells are purified from it and cultured in a laboratory dish. The cells are incubated with a type of virus in which the viral genetic material has been engineered to carry a normal copy of the gamma C gene. During incubation with the engineered virus, the genetic material of the virus, including the normal copy of the gamma C gene, is incorporated into the DNA of the stem cells. The viral DNA incorporates randomly into the chromosomes, such that different cells contain the inserted DNA at different chromosomal locations. In this procedure, there's always the risk that the inserted DNA will land in or near a gene, either making the gene non-functional or turning up the gene's expression level. Depending on the gene, there's a possibility that the cell can become cancerous. In this procedure, about 30% of the manipulated stem cells contain and turn on the normal copy of the gamma C gene. The stem cells are transferred back into the patient, where they repopulate the bone marrow and serve as normal progenitor cells to make T cells and natural killer cells.